The White House is warning Americans to prepare for what they call the saddest and hardest week of our lives. The Surgeon General this weekend likened it to a combination of Pearl Harbor and 9/11. So Ben Tracy's been standing by at the White House for us. Ben, we know that the expectation is that the numbers are going to tick up, that people who maybe were infected a couple of weeks ago are going to start to get very, very sick, and those who have been in the hospital who are struggling and who are not improving may in fact die. But what is the White House specifically telling us as Americans to prepare for?
They're saying it's going to be bad, that this week and next week really could be some of the worst of this, and that's because they're expecting the number of cases and deaths in these current hotspots, New York, New Orleans, Detroit, to spike. And some of the models, when you look into them, they're predicting as many as 3,000 deaths per day at the peak of this, which looks to be hitting around April 15th, April 16th. That will also put tremendous pressure on the hospitals in those cities and any other areas that might flare up as hotspots in the meantime.
Ben, as you know, the president at these press briefings has been recommending the drug hydroxychloroquine to help fight the virus. However, top doctors, including Dr. Anthony Fauci, remain cautious about the drug's efficacy. What can you tell us about the internal dynamics within the White House between the medical professionals, people who understand science, and those who are focused on perhaps the politics, or as the president has pointed out when he steps in front of the camera, the fact that he knows that he gets good ratings when he leads these press briefings? What do you know about that push and pull, for example, between Dr. Fauci and somebody like Peter Navarro? Sorry.
Well, yeah, and it's pretty clear that the president is looking for any bit of positive news he can find, and he's acknowledged that. He said that he's a cheerleader for the country. He's trying to find the positives here because he doesn't want people to die. But when it comes to recommending medication from a podium at the White House, it is very unusual how often the president talks about this. And the bottom line with the drug is there are no widespread clinical trials that show that this drug works to treat coronavirus. We just don't know. The president keeps saying that it's not dangerous, so why not just try it? But other doctors say, no, that's not true either. It can be dangerous to people who might have other health conditions. This is a drug that's used as an anti-malarial drug. It's a drug that people take when they have lupus. But there is a push and pull here at the White House where you have Dr. Fauci basically saying there is no science to say that this will work for coronavirus. It's anecdotal at best, the evidence. But then there was this dust up over the weekend in the Situation Room here at the White House on Saturday where Fauci and Peter Navarro, who is one of the president's economic advisors, not a medical doctor and not somebody that you would think would be involved in these discussions, basically got into a very heated disagreement about whether or not this drug would work, with Navarro saying that he's researched it and he thinks it works, and Fauci saying there's just not science to back up that claim. And Peter Navarro basically acknowledged that that conversation happened this weekend in an interview he did this morning.
So we've got that going on, right? And then there is, how the hospitals are coping. And an Inspector General's report from the Department of Health and Human Services was released, taking a look at that specifically, how hospitals are handling this pandemic. What were the results of that report?
This is pretty stunning. I mean, basically, of the hospitals in the country that are surveyed, 3 out of every 4 hospitals in this country are now dealing with coronavirus patients. So this is something that we are seeing all over the country, very widespread. But this report shows a real lack of supplies, and that the situations in a lot of these hospitals is going to get critical because they don't have basic supplies like even thermometers. We've all heard about the lack of ventilators and N95 masks and those sorts of things, which are critical to addressing the needs of these patients. But even things like thermometers are in low supply in these hospitals. So this basically reinforces what we've been seeing in news reports on CBS and elsewhere about what's going on in these ICUs, but it's very troubling to see that this is a widespread problem across the country.
Ben, let me ask you about small businesses. They were finally able to apply for loans through the new Paycheck Protection Program. What are we hearing from banks after the official launch of the program?
there is a ton of demand, so much demand that Wells Fargo said they basically have burned through all the money that they had allocated for these loans. And, you know, the president has said that he thinks the rollout of this has been perfect. He's one of the few people that believe that. Even Senator Marco Rubio this morning said there's been some real issues with this program. A lot of the big banks were holding back on issuing these loans when the program started on Friday because they said they just don't have enough guidance or assurances from the government as to how to give these loans out, how to decide who gets them, and then also the assurances that these loans would be covered by the government if that's necessary. So there are some issues there, and there is now a growing belief that there's also not enough money in the pot, that there are so many small businesses that are in danger, that are in jeopardy, that Congress is going to have to allocate more money for this program. And then the Small Business Administration will also have to kind of fine-tune the rules here to make sure that this program is working.
So, Ben, last week, I think we all learned that perhaps wearing masks would be beneficial, particularly if you are asymptomatic and you run the risk of spreading the virus. And it looks like the military is kind of looking at that advice as well. There are some new guidelines being issued for personnel in regards to wearing masks. What are they?
Yeah, and this is more than advice for the military. The Secretary of Defense signed a memo last night that orders all military personnel on Department of Defense property to wear some sort of cloth face covering. Now, the military is not handing out masks to every single person that it employs. They're not going to be giving away these N95 masks that are in very critical need by medical providers. They're basically telling people you can make a face covering out of a T-shirt, you can make it out of a bandana, but you are now required to have that if you're going to be on grounds that are owned by the Department of Defense. Meanwhile, you have the president here at the White House. He was asked again yesterday, would he wear a mask? Will he start wearing a mask when he's in groups of people? And he said, I don't know. He said, I would do it if I thought it was important. So certainly some mixed messages coming from the government.
Ben, finally, let me ask you about this. President Trump, as you know, fired the inspector general who handled the whistleblower complaint. That led to his impeachment. I note that the president this morning is tweeting his son, attacking the media. He's tweeting about the Republicans in Congress who are making noises about Democrats in Congress. What's been the aftermath of this decision? Why is the president, what are you hearing from the White House as to why the president seemingly in the midst of this pandemic is still focusing on the politics?
Well, the president has not been shy about it. I mean, he was asked about this on Saturday. So he made this decision Friday night to basically fire the Inspector General of the Intelligence Community. His name is Michael Atkinson. This is the person who delivered the whistleblower complaint that was central to the president's impeachment to Congress. And he did that because that is his job required by law. But the president still views that whistleblower complaint as something that was fake and made up and not legitimate, and therefore he believes this Inspector General should not have followed the law and done his job. So the president was asked about this on Saturday. He very openly said, I think this guy did a horrible job and he should have been fired, and it's my right to fire him. So the president's been pretty direct about that. What's interesting now is in the last 24 hours, Atkinson released his own statement basically saying he's disappointed that the president lost confidence in him, and he very directly said, I think I got fired for doing my job and following the law.